this slide basically is talking about what I've just discussed, some of the manifestations that you will find in an abused patient. So injuries that especially in various stages of healing, and they actually try to actively hide those injuries. Like I said, by making use of scarves. The child is wearing a polo neck in the middle of summer. We have repeated injuries. We have chipped or injured teeth. We have scars on the inside of lips and the tongue. That's why, ladies and gentlemen, if like when you're talking to mommy or daddy and they actually do mention that maybe there is a third party caretaker of the child, to actually just encourage them to actually look into their children's mouth for any marks or signs that should not be there, because that in and of itself, and that they cannot explain, this would then help monitor whoever is the caretaker so that appropriate steps can be taken against them if necessary. From there, we have battering or other injuries around the head and neck. We have facial bruises, swellings or black eyes, fractured nose or broken teeth, bite marks on the child that you will see. And then from there, cigarette or other burning marks, they do actually take a pattern, especially if maybe the child is being beat using instruments such as belts and shoes. You can actually get them to even undress or just try and look for those signs on the child. And then from there, injuries that are not consistent with the patient or the caretaker's explanations. Like sometimes they'll be like a child could literally have like a blue eye, and then they'll be like, a glass fell on the child. That does not make sense. So that's like a stupid example of an injury that is not consistent with the parents or the caretaker's explanation. So this slide on the possible signs of abuse that we find in our dental practices, orofacially and dentally, clinically, very, very, very important. I expect you guys to know them, because you will find them in kids with parents or from abusive households, especially also with kids with special needs. Please be aware, because they do not have the mental faculties to actually express what's going on, or they've limited physical capabilities, so they really can't convey what's happening to them. They are especially prone to abuse because some caretakers are not as good as we'd like them to be, unfortunately. So we have to pay extra attention to these signs, make sure they are there, so that if they are there, and let's say it's a state mandated carer, that we can actually report it to the proper authorities, and then let them actually investigate the matter further. From there, should we have found certain questionable things or signs on a child, we'll then have to report it to Child Protective Services. It is your legal duty. It is, ladies and gentlemen, your legal duty to report any and all suspicions. Please also make sure and note the nature of your concern, and try to describe with as much detail as possible the description of the injury. It is also very, very important, ladies and gentlemen, that we do not alert a possible perpetrator of this abuse. So we just keep quiet. We make sure that we report on the side, and then they'll just be surprised as the authorities actually come in and take the matter further. To back up our claim, ladies and gentlemen, we must have clinical evidence. So clinical evidence would be, for example, x-rays, be it periapical as well as our cephalometric x-rays, especially if you see suspicious fracture to the teeth as well as the jaw bones. You would then also take a ceph to back up your claim, and then as well as taking photographs. Now, with photographs, it's a bit awkward, especially if, let's say, the perpetrator of said abuse is there. But thankfully, ladies and gentlemen, like, you have to be very smart and savvy when it comes to such situations. Like, for example, when we take x-rays, no one has to be or should be in the x-ray room except for, let's say, the operator of the x-ray as well as the patient. So in that time, when you have that alone time, when you can break the connection between the perpetrator and the child, quickly take those pictures while said possible perpetrator is outside of the room, né? And then from there, take the patient and the parent's personal data that you would have received on the file that they would have been expected to fill out before they actually got into the clinical area. Then from there, write an explanation that has been given for the injury, as well as the physician's name. So whoever your practitioner's name is, you'll jot that down in your report to Child Protective Services. Ladies and gentlemen, it's very, 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 very important to get consent before you proceed with any form of treatment or procedure on pediatric patients. We must get informed consent from either the parent or the guardian, and they must give signed consent for the treatment for legal implications. I know kids from the age of 12, if I'm not mistaken, if they do not consent to a procedure, you legally cannot force them to do a procedure as well. So keep in mind those nitty-gritty HPCSA as well as medical legal statutes that we have in South Africa before going forward with pediatric patients. And then from there, we have to ensure that the child considers the dental assistant as a substitute for the parent and seek guidance from them. So that's where, as a dental assistant, you have to make sure that you are up to date and well informed about procedures, what we're doing, what we're not doing, so that you can give patients as well as their parents or caregivers as much information as you possibly can. And then from there, let's remember that children are not adults, and adults must become a child or become children to work successfully with a child. So we're saying that to say, ladies and gentlemen, that when dealing with kids, you have to go all the way back, bring out your inner child, that inner, I can say, gullible space of being a child, so that you can actually get them to that level, cooperate with them, and get their cooperation at the end of the day. Okay, ladies and gentlemen, that is it from Dr. Oosthuizen's presentation. We expect you guys to know about fissure sealants, how to place them, the role of the dental assistant from the first initial appointment with a pediatric patient all the way up to the developmental stages. I personally feel that these slides are rather incomplete because they did not cover special needs children quite extensively. So if needs be, I'll have to maybe make a presentation of my own just to cover special needs patients of ours, because you will find them in dental practices. And then from there, I expect you guys to know the emergency procedures that we had discussed. There are some procedures that were not touched on that you'll also find, such as stainless steel crowns, pulpectomies, which is basically endodontic treatment for pediatric kids. So I feel like I need to tie all of that together, but I think I've mentioned what is important from this slide. I'll check under learning unit number 16 if there's more things that we need to discuss that we'll not discuss here. If there is, and maybe they're not under learning unit 16, because I want you guys to be on pace with what is happening in the real world, I'll have to maybe make a presentation of my own, as I had mentioned, and quickly present it and place it on YouTube, of things that I feel are also important that weren't necessarily covered here, because pediatric dentistry is actually quite broad. Okay, but yeah, I think you'll hear from me. But that's it for this lecture. I hope you guys had fun. I hope you guys learned something. If you guys have any questions, please feel free to comment below in the comment section of our YouTube channel, or email me. I'll not hesitate to answer you guys, so that you guys have greater clarity on what's going on with our pediatric patients. Okay, but I'll see you guys on the flip side. Okay, bye. Mwah.